Mental health issues in the United States are increasing at a staggering rate. In 2021, the National Institute of Mental Health stated that approximately 57.8 million people in this country are living with a mental illness, some of which go untreated, and unfortunately, that number is on the rise every year. Today's show is the second in our quarterly mental health moment. Taking care of your mental health is just as important as taking care of your physical health. I'm sitting down today with licensed alcohol and drug abuse counselor and mental health care provider Lindsay Cardin to talk about the importance of education and awareness. Lindsay, thank you so much for coming on today to talk about this really important topic.
Thank you so much for having me. Yeah, mental health is extremely important, and I'm really happy to be here to talk about it.
Listen, I know how much that bringing awareness to people about mental health issues and even substance abuse issues or substance use disorders is to you because, like I said in the intro, you are a licensed alcohol and drug abuse counselor and a mental health care provider who I had the pleasure of meeting over a year ago, and you've become a good friend to me. And, you know, like I said, every day at work last year, you were my mentor. I looked up to you, and I still do. And I'm so happy that you're here to pour into our viewing audience the knowledge and the wisdom that you have on both of these topics.
Thank you. I really appreciate it. Yeah, the 1 in 7 Americans has reported having a substance use issue. So it is a really important topic.
Yeah, that's unbelievable. I'm telling you, it's like, of course, when I was little, I'm a lot older than you, but when I was little, I don't know if people dealt with that and nobody said anything, or if it has gotten worse since then. But that statistic is really sad. 1 in 7 people. We all know, I don't care who you are, everyone knows somebody who has been touched by this terrible disorder. So,
yeah, I mean, there were over 100,000 overdose deaths last year. So, I mean, it's pretty severe.
Yeah, we've got to do something. So last year when you were on the show, you were my 4th guest on my 4th show, and you talked about the effects of drug use and recovery, and you told your own story, which was just so beautiful. And did you know that was one of my highest viewed episodes?
You told me that, but it really surprised me. I mean, it didn't shock me in that, I do feel that it's a subject that touches a lot of people in a lot of different ways. It surprised me because, who am I? But I do feel like it touches so many people.
Yeah, I agree. I think that's why it was so viewed because I think that there's an overwhelming desire within the viewing audience to either help themselves or help people that they love. And so anytime that they see anything, and I have a lot of people who watch regularly. I have people that if the episode doesn't upload at 5 o'clock, they are messaging me saying, "Where's today's episode?" And so I know they're watching. And so, like I said, there's so many people who want to help people that they love. And so to have shows like this, I feel like it's very important. This is not one of my singing episodes where everybody's happy and all this, but this is a very important topic. So,
yeah, I mean, even people who haven't experienced substance use themselves can usually find someone pretty close to them that has experienced substance use issues or mental health issues. So, I mean, these topics are extremely important that we talk about and dive into.
I agree. So today you're here to talk about a somewhat controversial topic, and that is harm reduction. Yeah. So in a nutshell, can you tell our audience and even me, educate me on what is harm reduction?
Well, harm reduction is really anything that is reducing the harm in the community. And so it can be things like needle exchange programs. It can be using medication for opioid use disorder. It can be distributing naloxone, which is the name brand of that is Narcan, to reverse the effects of opioid overdose. There's a lot of different things that can be considered harm reduction.
So what's basically the purpose of harm reduction? Is it to keep people from dying? Is it to give them a chance, like that middle ground?
Yeah, I mean, it's reaching a population that we haven't been able to reach in the past. And, you know, giving people the autonomy to make decisions for themselves, and helping people get there that haven't been able to get there before.
So there's a large percentage, I think, from my experience, just being out and about, you know, because I've seen like tables set up before on a street corner where they give out the Narcan, and you can hear people complain about it and all that. So I feel like there's, I mean, I don't know any numbers, I didn't look this up, but I feel like there is a percentage of the population who are opposed to harm reduction. They would rather see people go the way of abstinence, which includes AA, the 12 steps, and all that. But abstinence doesn't work for everybody. So even though AA is a proven method, why do you think that harm reduction would be more viable to other people?
Well, actually, a lot of people don't realize that harm reduction actually can include abstinence. Now, abstinence does not necessarily include harm reduction, so it doesn't go both ways, but harm reduction gives people the autonomy to choose what's best for them. And so, yes, in a lot of ways, abstinence-based programs are great for people, but it doesn't always work. And for some people, there needs to be another option. There needs to be other options out there, and we need to keep people alive so that they have these other options.
I agree. I love that. We do need to keep people alive, you know. I mean, it's just that bottom line. We need to keep people alive. So,
Yeah.
So I think that, you know, as I was doing my research, I was like, okay, people use harm reduction kind of like every day in their everyday lives, and they don't even realize it.
Yeah.
Like wearing a seatbelt when you're driving, that's
Yeah.
a form of harm reduction. Putting on a helmet when you ride a motorcycle, that's a form of harm reduction. So people use it and they're okay with it. I mean, you know, people get mad and say, buckle up, buckle your seatbelt. If somebody's in my car, I'm like, buckle up, I'm not moving until you do. So why is there such a stigma associated with harm reduction when it comes to, you know, tapering off substances?
You know, that's a really good question. I don't really know, you know, what people's mindsets are, or, you know, why there's such a stigma, but there is a stigma. It's been around for a long time, and, you know, people really have a hard time getting on board with harm reduction. But the fact is that things have changed. You know, fentanyl is one of the newer drugs that is becoming more prevalent, and it is 50 times stronger than heroin. It's 100 times stronger than morphine. So it's just, you know, we have to have newer and better methods to treat these things. And keeping people alive is extremely important. And so that's one of the reasons why harm reduction is so critical right now, especially.
Isn't I mean, correct me if I'm wrong, but isn't fentanyl what killed Michael Jackson? I think back in 2010.
I actually think that was not fentanyl, but I'm not 100% sure on that. I think he actually overdosed on like a sleeping medication.
Oh, okay.
But I'm not sure about
Oh,
that.
okay.
Yeah.
I don't know why that was in my mind, you know, thinking that. So
Yeah.
I'd be wrong on that. So when we talk about harm reduction, you know, I see like the Suboxone clinics and stuff like that. Is that part of harm reduction too, taking those alternatives?
Yes, it is. So Suboxone and Subutex and methadone, all of those are medication-assisted treatment programs for people. It helps them to be able to come off of opioids, and it's a great option for people who have struggled with that in the past. I mean, and if you think about it, a lot of times we're treating populations where they're not able to change their people, places, and things, which is one of the main things that they say in abstinence-based programs is change your people, places, and things, right? But a lot of times we're treating people who don't have the ability to do that. And they're going to go back into that same environment with the same people and the same places and the same things. And they're going to be struggling. And so we've got to give them other options.
Well, so Lindsay, in a perfect world, we wouldn't have an opioid epidemic. But, we live in reality. We don't live in a perfect world, and there's drugs everywhere. So what would you say to those who are against harm reduction, who talk bad about it? What would you say to them? Because you're in the trenches every day, and you see this, and you see how it works. And also, let me give you an extra question on top of that.
Okay.
Not only what would you say, but I'll ask you the second question after you answer that one.
Okay. People who are opposed to harm reduction, they have every right to have their feelings about it, and I get it. Like, it's something that's new and it's different, and their reasoning behind it is valid, and I get it. We want to help people, and their reasoning behind it is that they feel that we're giving people permission to continue using. But actually, the studies that have been done show that where there is naloxone distributed and medically assisted treatment programs or medication used to treat opioids, there is a reduction in overdose deaths. So you can't dispute that, right? That's evidence that this is saving lives. And isn't that what we're trying to do?
Yeah.
Right? Like, we have to save lives. If we don't save their lives, there is no hope.
Yeah.
We can't help them, right? And so we have to keep people alive in order to be able to help them. And the other thing is that our brains take a long time to rewire. I mean, when we're addicted to drugs, our brains get like the wires get completely messed up, and we have to rewire our brains, and that takes a while. It takes up to 2 years of continual work on ourselves and practicing new behaviors and learning how to live a different way. And if we're doing that while taking the medication, then at some point, if we want to come off of the medication, then our brains are, we've been working on them. They're rewired now. It would be easier for us to do that and not be as concerned about a relapse. But if I go straight into an abstinence-based program without the rewiring of my brain, I am at risk for a relapse much, much higher than someone that has had that time. And so with things out there such as fentanyl, and now xylazine is huge right now, and I can tell you more about that. But with those things out there, like we have to consider that, and we have to give ourselves time to rewire the brain.
You answered my question, actually, before I even asked it. I was going to ask you, what are some numbers, or do you have like the studies? And you just told me that, there is proof that this works. The MAT is what we call it, the medication.
Well, I mean, there's been all kinds of studies. There was a study done in 2003 by Dr. Chatwell. He's with Massachusetts General Hospital. And in his study, he looked at 4 different states. It was Massachusetts, Ohio, Kentucky, and New York. And in that study, he looked to see what were the changes in overdose deaths for people who were treated with medication for their opioid use disorder, and also were distributed naloxone. And the overdose deaths in all 4 states where those services were provided were reduced.
Wow.
So the proof is in the pudding, right?
It's there. Yeah, absolutely. Love that. Love that. And I could tell you're just very passionate about this. And it's, because like it's close to home for you. And we need more people like you with that heart for people to save their lives and to want to save their lives. So many people are judged. Listen, I can't tell you the number of people that I see on Facebook who, people are on like the side we're on, and then people are on the polar opposite side, and they judge people. And I'm like, man, don't ever, because you have no idea. Don't ever do that. People are just deemed unworthy of help. And it couldn't be further from the truth, because we're all God's children. Every human is the same. And that's what I tried to tell people at work last year. I'm like, you're valuable because you're a human. You're worthy because you're a human. And it doesn't change because, like, Mr. X has a hard time with like fentanyl, and I might have a hard time with food. I mean, I'm no different. They're no different than me. I'm no different than them. We're all the same. So thank you for being so passionate and for being out there in the trenches, like I said, every day. So what would you say to somebody?
Can I say something to
can.
that real quick? Because actually, not that long ago, I was one of those people who, I wouldn't say I had like harsh judgments, but I did have judgments because I didn't think I would ever end up in the places that I ended up. And I believed that, people could control themselves, and that they didn't have to let it get as bad as they did. And, and that there was, they had a choice, and I was wrong. And I learned that by my own experience. And so I don't judge people who judge people, because the reality is that, like, I get it. I understand why you feel that way. And I was there. But I'm asking you to take a different look, because it's not always what you think. And it wasn't what I thought it was. People are doing the best they can with what they have. And addiction is really tricky, and it sneaks up on you, and you don't have an opportunity to do anything about it until it's too late most of the time, because it tricks your brain into thinking you have control. And so by the time you realize you don't have control, it's too late to do anything about it. And so it's really hard. It's really, really hard. And so, like, I get and I get the stigma too of like I said, the harm reduction. Like, I get the stigma of that too, because people are scared that we're helping make the situation worse by distributing clean needles, that we're giving people a right to continue using, but we're not. We're keeping people safe so that they don't end up with HIV, right? So that we can then help them at some point in the future get treatment, right? Yeah. So they're not sick when they're getting treatment.
So while I'm sure they're not just being handed needles, they're probably being educated as well on the harm reduction and stuff like that. So it's not like, hey, let me give you a pack of needles and see you next time. Yeah. They're being educated and made aware, this is why you need to do this, and this is the steps you can take. So and when you were talking, I thought, if we all could just have compassion on each other, just compassion, have compassion, because listen, I'll tell you something else that's an addiction as well. It's not just drugs, gambling.
Yeah.
Man, let me tell you, I've had my problems with gambling in the past. I mean, it's been, so gambling, and that, when you said that drugs trick your brain, gambling does too, because when you're doing it, it feels so good to be winning, and then you lose and you try to get that back, and then you just don't you don't see everything that you're leaving to the side. You don't see unpaid bills. You don't see all the things, and you just don't see it until it's too late.
Yeah.
And that's any kind of addiction. I imagine, like, I can't imagine, but I imagine that because drugs do mess with the chemistry in your brain and all that. It does mess with all that in a different way than, like, say, if you have like an eating disorder or whatever. So, but yeah, I mean, so addiction is addiction, and we just need to have more compassion on each other. So,
Yeah.
what would you say to somebody, Lindsay, who might be watching that wants to get help but might be too scared, doesn't know where to turn to, maybe too embarrassed? What would you say to them?
Well, first of all, don't be embarrassed, because it's not anything to be ashamed of. This addiction doesn't discriminate. It can hit anybody. It can attach itself to anybody in any social status, in any culture. There's just no bounds to it, right? Like it just can touch anyone, and so there's no shame in that. And if you're suffering because of addiction, then let someone help you. And when people reach out for help, we have to be there to offer the kind of help that they're ready to achieve. And I think that's really important that we look at that, because a lot of times people aren't ready to come and do an abstinence-based program, but they want help. And we've got to give them some kind of help. And so that's where harm reduction comes in. And being there to help mitigate harm is extremely, extremely important. I mean, there's things right now, like I was telling you earlier about xylazine, that, this is a horse tranquilizer that is showing up right now. And this is, really a big deal. It's showing up a lot in the South, in the drugs that people are using. It's getting mixed in with the drugs, just like fentanyl is. And it's very, very dangerous. It is also causing overdoses. It is also, because what it does is it slows down your breathing. And it's also, it can cause open wounds, which can get infected, and then you can lose limbs as a result of it. And so, like, it's so important that we have the help available for people, even if it's just wound care. It's so, so critical. But the opposite of addiction is connection. And so when we try to help people, if they don't feel that connection from us,
Absolutely.
then they're not going to get the help that they need.
Yeah, people have to trust who they're turning to for help. They have, and that we know that from the job that we had last year. That's what I tried to say. You can trust me. I wanted people to trust me and know that they were safe with me. Because listen, if I go to the doctor and I don't feel like I can trust them, I'm not going to open up. I'm just not going to do it, and I'm not going to feel like they're there for my well-being and to help me.
Yeah,
I might feel like, well, they're just here to make $1.
Right.
So, yeah, I love that connection.
Yeah.
So the opposite, what did you say? The opposite
The
of addiction
opposite of addiction is connection.
Yeah, I love that.
There's a difference between enabling somebody and showing them that you care enough about them to help them. And we have to show people that we care enough about them to help them, and that we're there for them whenever they're ready. And that means sometimes giving them the kind of help that they want. And that's not always what we want for them. But if we can give them what they're ready for, maybe at some point they'll say, okay, I'm ready to try this abstinence now, right?
Yeah.
But we've got to get them to a point where they can even have that option.
Yeah, I was going to say, when you said that, it's not a one size fits all. Like,
Right.
it's not, what might be good for me, even like, let's say, like, a diet program, whatever, what works for me might not work for you, or the opposite, so we really have to meet people where they're at.
Yeah.
And it's just like listen, I say this so much, Adam's probably sick of hearing me say it. I say it on a lot of shows, but it's so true. Like with our kids, I hate standardized testing. I may have even said it to you. I hate that because not every child learns the same. Not every child is the same. And we really have to find out what works best for each individual. And that goes for, adults as well, no matter what we're going through. And I wouldn't want, like, if we went to, when we used to do group therapy, we didn't go in with the topic and expect it to work for all 20 people. Some might get it, some might not.
Yeah.
Because people are in different places in their lives. So
sometimes we change the topic based on what they needed in the moment.
Absolutely, yeah. So, well, listen, I want to thank you so much for coming on. This means a lot to me. It really does because, I'm passionate about the mental health issues as well. Mental health, for my own reasons, stemming from childhood on up.
Yeah.
And I just really appreciate you being so passionate and wanting to make people aware and want to give people help. Thank you so much.
Well, I really appreciate you having me on because like I said, I am really passionate about this and people need to know why we're doing it, what it's about. And so thank you so much for shedding light to this subject. It really means a lot that you're doing this and that you're talking about this and that you're giving people a platform to talk about these subjects.
You're welcome, definitely. So thank you guys for watching today. If you need help or if you need anybody that needs help, please contact the Substance Abuse and Mental Health Services Administration at 1-800-662-4357. And Lindsay will be back in September for another mental health moment. This is our quarterly series, and Lindsay's going to be our guest 4 times a year. I think that's 4 times a year, quarterly, or is that 3 times? I don't know. You guys can figure that out. Quarterly.
I'm terrible at math. Don't ask me.
Too. So I think it's 4 times a year. But anyway, you'll be back in September. Maybe it's 3 times. I'm not sure. But until then, do something to take care of yourself. Like, give yourself some self-care. Give yourself some self-love because you deserve it. Everybody deserves to have good mental health. Mm-hmm. And join me again next week for another great episode. And remember to always dream big because big dreams do come true.